Prevention is better than cure. That has served as the cardinal guideline in the last 50 years for the Saku Central Hospital to guide its steps in moving forward together with the local farming population. It is precisely in line with this dictum that the hospital regularly sends out a caravan mass health screening team to rural communities under a multiphasic outreach healthcare program in response to a call from their residents, however far off they may be in this alpine prefecture. The healthcare program implemented under the motto of prevention is better than cure comes in two phases: a basic health checkup and, if need be, a workup. Both screenings are made up of an elaborate checklist of items. Let's look at the basic health checkup first. This checkup is performed at the local assembly hall. Each examinee comes to the hall carrying his or her health pocketbook. The checkup consists of EKG, blood and urine tests, medical examination, measurement of blood pressure, examination of skin cancer resulting from long exposure to ultraviolet rays. In recent years, the screening team has come to focus more on the early detection of cancer and the prevention of seikatsu shukanbyo, or lifestyle-induced ailments, or seijinbyo, or diseases progressively degenerative with age. Already in the early morning, the X-ray camera-loaded van is on the way to the community where a mass health checkup will be performed, known as the Caravan Mass Health Screening. It is a common practice for this hospital to carry it out with the cooperation of the local administrative authorities and agricultural cooperatives.
お腹を膨らませて楽にしてそこでね息を止めてましょう。しっかり息を止めてます。
粉になっておりますからね。口の奥へ入れて、これが一番先です。これ2番目水です。はいどうぞ。息を止めてましょうか。しっかり息を止めてましょう。ぐるーっと回って仰向け。はい、向こう向いて真横、右下で真横です。もっと横になっちゃって、もっと横になって、はい、いいですよ、はい、いいですよ。そこでね、息を吸って、ずーっと吐いて、はい、止めてましょう。しっかり息を止めてます。はい。
With the screening scheduled to start at 6:30 in the morning, the medical staff has to leave the hospital shortly before 6. Persons in whom suspected symptoms have been detected and those with anamnesis are told to undergo an endoscopic stomach workup. In many instances, the screening starts in the early morning in response to a call from some local residents who, after the screening, want to have breakfast and then go to work. More than anything else, the Saku Central Hospital has attached importance to the needs of community residents in the last 50 years. Coined by Dr. Toshikazu Wakatsuki, founder of the hospital, the rallying words, "Together with farmers," crystallize its philosophies and approaches.
だからこれまたね、これかなり敷き詰めてるから、もしこれバリウム飲んでね、と引っかかっちゃう可能性あるから、また来年もカメラでやりましょう。
Kept in the archives of the hospital is an old film which depicts the way in which its staff delivered medical care in an out-of-the-way hamlet to which they'd been sent out during their off-duty hours in the 1950s. In those years, almost every village deep in the mountains of Nagano Prefecture was without medical services. Looking back through the vistas of the past, Dr. Wakatsuki has this to say. Virtually every visitor to our hospital's clinics suffered from diseases too late to cure. Naturally, it was important for us to do the best we could for them. But the more important thing was to go to their villages and work for the early detection of illnesses. By doing so, we endeavored to satisfy their needs. Physicians, nurses and paramedics went out to doctorless villages on holidays to deliver medical care on a voluntary basis. They made it a practice to put on a health-related drama or give a puppet show after the delivery of medical care. All the dramas were of Dr. Wakatsuki's own writing, and the actors and actresses were all from the hospital staff. Virtually no commercial entertainment was accessible in rural communities. Villagers really enjoyed the dramas presented by the medical team, thanks to which they could come to know bit by bit about health, hygiene and disease. Then there came increasing calls from the outlying villagers for the dispatch of a medical team. In response to these requests, the hospital formed a team which would go the round of hamlets without physicians during their off-duty hours on a regular basis. Here the hospital's motto, "Together with farmers," was at last translated into action. The medical team found an astonishingly large number of villagers with serious symptoms. Their illnesses gradually worsened while they bore the pain with stoical resignation and toiled at their farm work. They were so appallingly poor that they had to do so in order to live. Sent out from the hospital, physicians, nurses and paramedics went as far as going into the fields and checking the health of those at work there. It was a common practice for all family members to do farm work together unless they were seriously sick in bed. While delivering medical care in hamlets without physicians, the hospital staff came across many patients whose symptoms medically proved too late to cure. Dr. Wakatsuki categorized into two types the diseases traditionally peculiar to farming populations: the diseases which the patients adamantly tried to put up with, and those of which the patients remained unconscious. His classification would eventually prove to be a milestone in the milieu of rural medicine in Japan. Until the early 1960s, Japanese agriculture had relied solely on the work of people and cattle. Rice production and rice replanting in particular required quite heavy labor. Many hours of work in the paddy fields would result in people falling victim to hiesho, a syndrome deriving from the cold, and lumbago. A conspicuous effect of hard labor was that, having done farm work in a stooping position as often as not for many years, old farm workers eventually developed bent backs. Frequently carrying heavy things on a pole was responsible in most cases for the deformed shoulders and knees that were seen. Japanese farm workers primarily used barnyard manure and human waste as fertilizer, with the result that every villager carried intestinal worms. The meals consisted mostly of carbohydrates and salty food. The protein intake was insignificantly small. Many people in the rural areas suffered and died from hypertension. The rural dwellings in those years were appallingly dilapidated and unsanitary. Cattle were treasured so much that they were housed under the same roof as humans. It was by no means uncommon to see clouds of flies incessantly swarming. A check is made here on the incidence of tender vaginitis, an inflammation of a tendon and its sheath. The black thread tied around the wrist is what farm workers use to try to charm away the disease, believing that by so doing it would be healed sooner or later. This absurd superstition died hard. The doctor examines an extraordinarily warped spine and waist. The shoulder muscle is seen to be deformed from using a carrying pole. This man has a huge bump on the right shoulder. Dr. Wakatsuki began to perform a series of exhaustive surveys on the symptoms traditionally peculiar to Japanese farm workers and their environment. The surveys led him to hold an unshakable belief that prevention is better than cure. In 1949, Dr. Wakatsuki became the first Japanese surgeon to successfully operate on a patient for spinal caries. It evoked a tremendous reaction in the Japan Surgical Society, in which it had been traditionally considered inadvisable to surgically treat this ailment. Poverty and overwork were primarily responsible for its occurrence. An attempt is being made here to corroboratively verify survey findings in an animal test. As their limbs were overburdened, farm workers would often suffer from tender vaginitis, an inflammation of a tendon and its sheath. With the limbs of a rabbit kept in the water, an experiment is conducted on hiesho, or a syndrome stemming from the cold, which farm workers had to put up with while working in the painfully cold paddy fields. In this experiment, a freezer is used to cast light on the effects of a house with absolutely no heating system whatever on man's health. Here, a German shepherd is seen caged next to a rabbit in an experiment designed to check and see how the rabbit's internal organs will be adversely affected by the stress. The object is to gain an idea of the degree to which the housewife's health will be adversely affected when she tries to justify her routine behavior and lifestyle before her mother-in-law in a feudalistic family. With all sorts of experiments, surveys and researches done, Dr. Wakatsuki came to realize that there was a widespread prevalence of symptoms of a sort which was traditionally peculiar to Japanese farmers. He named them Nofusho, or the Japanese farmer's syndrome. In an attempt to stamp out Nofusho, Dr. Wakatsuki felt it absolutely necessary to establish an entirely new milieu of medical science which would feature an elaborate blending of preventive medicine and social science. The health-oriented science thus established was named rural medicine. It is now accepted that Nofusho was a series of premonitory symptoms of what we know today as Seikatsu Shukanbyo, or lifestyle-induced diseases, or Seijinbyo, ailments progressively degenerative over time. The Japanese Association of Rural Medicine was established in 1952. In no way is rural medicine learning for learning's sake. It is a science designed specifically to protect the lives of farm workers. This science must always sustain itself in line with humanism and democracy. Unite all people who are determined to devote themselves to the delivery of health and medical care to rural populations. The Saku Central Hospital holds an annual open house festival on the same day as Komansai, the town's traditional silkworm festival. On this particular day, the hospital's facilities were crowded with townspeople and visitors from other communities. The hospital's festival might well be described as a novel type of exhibition on health and disease. The idea is to provide visitors with information put together in plain language, both on panels and in question and answer sessions, in attempts to encourage visitors to renew their determination to protect their own health. In previous festivals, all displays were prepared and the briefings made by specialists on the hospital staff, and this approach remains unchanged. This system of calisthenics was worked out by the hospital staff long ago, and a demonstration is still held at each year's hospital festival. The hospital staff are unsparing of themselves in stepping up interchanges with local residents. Here they all get together in singing the hospital's songs, together with farmers and caravan health screening team. The delivery of medical care in hamlets without physicians eventually gave rise to requests to the hospital. Couldn't the health checkup be performed on a regular basis? Couldn't it cover all villagers, not just those who wanted to undergo it? As a result, the idea developed of working out an all-inclusive healthcare system in which the hospital would cover all villagers in a series of annual checkups. The first such screening was performed in the village of Yachiho, 10 kilometers south of the hospital in 1959, and covered every one of the villagers. All staff members of the hospital involved themselves in this project. They give themselves unsparingly, keenly aware of the need to teach everyone. The screening begins first with an interview on health, lifestyle and environment. It is followed by the measurement of height and weight, a urine test, the measurement of blood pressure, and a medical examination. Then local public health nurses give counselling and advice on health and nutrition. It might be said that the basic ingredients of today's sophisticated health screening program can be traced back to what the hospital staff worked out in those years. On the basis of the findings of the health screenings, the hospital's healthcare department designed a health pocketbook, in which each examinee can make entries on his or her health condition. Some days after a mass screening, the hospital staff customarily hold a meeting in each hamlet to report about the findings and give a briefing both to the examinees and their group as a whole on how to promote good health. It was decided that each community should nominate health guidance committee men from among its residents who would meet to discuss all aspects of health care on a regular basis. Thus it could be successfully corroborated through the involvement of villagers that prevention is better than cure. This scene was filmed in 1967. Structural reforms in the economic and technological sectors began to spread across the world in the 60s, compelling Japanese agriculture to undergo drastic changes as well. Above all, the use of newly developed pesticides spread and enabled farmers to produce enormous crops. Yet in another aspect, there was an alarmingly sharp rise in the number of farmers poisoned with pesticides, and the complaints they suffered from differed widely. Naturally, physicians were compelled to do something about this unwanted new development. Instead of waiting for the visit of afflicted farmers, the hospital hastily formed a team of specialists which would be sent out to administer first aid on the spot. Here, the hospital put into effect the findings of corroborative studies and experiments the hospital had accumulated in their endeavour to combat Norfushaw. A greater amount of residual mercury is detected from the hair of neonates than from that of their mothers, leading the hospital staff to suspect that organic mercury used as a pesticide might be accumulated in fetuses. A monkey is used in this particular experiment on chronic organic mercury poisoning. Attempts were made to cast light on the symptoms detected in the monkey while checking them against the symptoms peculiar to Minamata disease. Young men in rural communities were increasingly lured into big cities, leaving farm work in the hands of their wives and elderly parents. Then completely new types of farm machinery came out, raising the incidence of unprecedented types of fatigue and injury. These developments became a new theme for rural medicine. At the 4th International Congress of Rural Medicine held at the Saku Central Hospital in 1969, pesticide poisoning and injuries caused by large-sized farm machinery were taken up as main themes.
And I very enjoyed it. Considers the practice of medicine, then such an attitude remains.
Participants from the Asian region focused their attention particularly on contagious diseases, parasites, malnutrition, and villages without physicians. At this Congress, Japan served to foster ties of scientific collaboration between Asia and Europe. This endeavour was strongly supported by people in the Saku district, for which the Saku Central Hospital served as the medical care complex. The number of Asian, African and Latin American visitors wishing to know about and learn at the Saku Central Hospital has increased year by year. They are conducted to the village where the hospital's mass health screening is currently underway. Recently, the hospital has dispatched a physician to Africa to do field work on temporary duty. The network of agricultural medicine and rural health is fanning out across the world. The most significant problems posed in the 1980s were depopulation and aging in rural areas. In the dramas now put on by the hospital's troupe, greater emphasis is put on new approaches to health problems in an ever-changing rural setting than on the dissemination of thoughts about health and hygiene as in the early years. The delivery of medical care cannot be taken into account without taking account of local cultural activities. The time has come when the hospital has to work out new approaches in a constantly changing society. The hospital's festival is as alive with visitors as it always has been. Nonetheless, information of the sort which has to be disseminated to the local communities has changed to keep pace with the times. Panels on AIDS are put on display for the first time at an in-house festival. The dissemination of correct knowledge of this ailment is part of the hospital's movement designed to protect people's health. The exhibition theme, which has become particularly important in recent years, concerns how old people can live successfully in an aging society. The meeting to talk with Dr. Wakatsuki has proved particularly popular among visitors to the hospital's festival. The subject being taken up here is the distinction between senile dementia and aging. A wide variety of questions are put to Dr. Wakatsuki about the timing of operations on patients for cataract.
ですから今先生のお話のように緑内障はもしあるとするとまたいろんなことあるかもしれませんから、その点をよく調べてはっきり病気があるかないかということを
Here, participants can ask any question, to which he gives a readily comprehensible answer.
また一安心ということになりますですね。
Dr.
そういうことですね。ぜひ健康
Dr. Wakatsky has continued to emphasize at talks with local residents in the last 50 years that a patient is the master, for whom medical workers simply do their work as servants, and that the rights of patients must be absolutely respected.
そういう権利はあんた方が持って、患者さんが持ってるんですからね。私ども一度ね、どこの会行ったからあとね、他行っちゃいけないってことはありませんから。この病院でダメだったらよその病院行ってもいいしですね。それはもうあんたの自由で、大体
こういう症状は私っきりじゃないです。
そうじゃない、そうじゃない。全然そうじゃない。
どうもありがとうございました。
On the wall of the waiting hall of the hospital is The Rights and Obligations of Patients, which was carefully composed in plain language and copy-read to make sure that it is easily understood. This is the Komi Clinic, which serves as a frontline medical center under the umbrella of the Saku Central Hospital. In its jurisdiction of medical care, the ratio of old people stands at nearly 30%. Komi has a subclinic specifically for traditional Chinese medicine, which is becoming increasingly popular among the local elderly. More than anything else, the Komi Clinic emphasizes the delivery of medical care at the homes of old people. It dispatches physicians, nurses and laboratory technicians to their homes as often as 2,000 times a year in aggregate. Physicians make it a practice to acquaint themselves with the local dialects. By so doing, they can talk with old people in a more amicable and carefree atmosphere before they decide what procedure is most suitable for the elaborate care they are given. Here, the radiographer puts a wooden board under the bed pad to fix the portable X-ray machine, which suggests that the staff must always be prepared for any contingency in making preparations for the delivery of care at the home of any patient. Depending on the attending physician's decision, even ultrasonic and endoscopic tests are performed at the homes of old people. The work of nurses assigned to visit the homes of old persons is not confined merely to physical care. They listen to their general conversation too. Recalling her childhood, this old lady has this to say. I used to have 10 brothers and sisters. Whenever I went to school, I used to have to carry one of them on my back. The important thing is spiritual care.
まだまだお迎えが来ないよ。
The delivery of emergency care is yet another important task assigned to the Komi Clinic. Having come for consultations to this medical centre time and again, this old man was brought in by ambulance. The clinic staff administer almost every kind of first aid. Any patient who the doctor decides requires more sophisticated medical care will be immediately referred to the Saku Central Hospital. The Komi Clinic would be unable to serve as a frontline medical outpost without close coordination with its mother hospital. The Komi Clinic offers services for the hospitalization of emergency care patients and the delivery of terminal care to cancer patients, doing the best it can to keep their caretakers from becoming run down through overwork.
血を取りますから、チクンとするけど動かないでね。ここちょっと注射。動かないでください。痛い？いや、まあ痛いと分かれば。あ、動かさないでね、すぐ終わりますからね。
Caretakers who attend to bedridden old people make it a practice to get together in the waiting hall of the clinic once a month to exchange views with and seek counsel and advice from its medical workers. Participants speak out plainly and without reserve at this meeting. Every one of them concedes that a really free exchange of views makes it possible for them to work off their frustrations. The caretakers themselves are old too. On top of that, most of them are women. There are increasing calls for the greater involvement of men. This is the Geriatric Health Services facility annexed to the Saku Central Hospital. It is a place where old people with some disorder or other live, but not as patients, and a station which renders extensive support to caretakers. Local residents expect much from this centre. It has long been a practice for pupils of the elementary school situated next to the facility to come in and chat and play with the old people once in a while. The visits by the children make old people's faces brighter. Both children and old people are keenly aware that their interchange is really something enjoyable and indispensable for them. "50 years have elapsed since the Saku Central Hospital began to provide outreach programs for hamlets without physicians under the motto, 'Together with Farmers.' In the meantime, agriculture, rural communities and farmers have all changed to a significant degree. Speaking of the hospital's future, Dr. Wakatsuki has this to say. Without unflinching efforts on the part of all hospital employees, without the close cooperation rendered by farmers, and without the guidance and support extended by all other people, the Saku Central Hospital would not have developed into what it is today. It is of secondary importance that ours has developed from a 20-bed clinic into a major regional hospital complex with 1,000 beds. Whether our hospital is really of value to local communities has yet to be proved. It will depend on how we continue to protect the health of local farmers and other community residents. The promotion of their health will perpetually remain a task assigned to the Saku Central Hospital.
Oh